Okay, Don McGann here, and we're now going to talk about Zygoma Ligation. Okay, we're going to be focusing up on the zygomatic buttress, the inferior of it, and I would like to point out to you some key anatomical issues. One of them is that there is a change from vertical to horizontal. There is a change from vertical to horizontal, okay? And this on the vertical is going to be the dental alveolar bone. And in a growing patient, this is where we usually use this zygoma ligation. In a growing patient, this is what we are trying to stop from moving forward. The teeth and bone, we are trying to secure back to the zygoma. Now, A point and the zygoma, everything up in this area here of the maxilla, all the way out to the zygomatic, the maxillary zygomatic suture right here, okay? We're trying to get into the zygomatic bone right out laterally. So we want to make our placement just lateral out here, lateral, not on the vertical, not on the vertical portion here, just laterally. Okay, so this one's actually quite easy. See here, that's a little short. It's not going to be easy if you make it too short. My assistant here, my trusty assistant, kind of a short one for me here. So before I start, I'm going to make a nice long one. Maybe not quite that long. Right about in there. So, 010, no, not 010, 012 ligature. And what I'd like to do is I'd like to make a rope again, like we did on the lower. So I'm going to twist this. And this one's a little longer because we're going to take it all the way up to the cuspid bracket base, okay? So you can see how long it's going to be. It's going to be all the way from there all the way down there. So the rope is pretty long. And of course you're going to make a rope so it doesn't come loose. There's no loose parts of the ligation because you're basically tying it back, and you don't want it slipping. You don't want the teeth and bones slipping. Okay, now the incision on this, we're going to palpate mesial right underneath the bridge here. We're going to palpate, okay? And I'd like to make an L flap. Now what I'm going to do is you see where the first molar is? That's usually where you are, just mesial to the first molar. Now what you want to stay away from, of course, although it's a long way away, but it's the inferior alveolar. No, not the inferior. Oh my gosh, I'm tired. That's the infraorbital nerve and a bundle. You don't want to be over there. So don't get too anterior. Stay away from this area in here. Just, so palpate the zygoma bone. Look at the first molar right here. Make like a vertical. Make a vertical. And then at the mucogingival junction, you can go back as far as you want, okay? But usually, like a centimeter or so is enough. Okay, then you take your periosteal elevator, and you're going to come right on the corner here, and you're just going to kind of push it back, and it's going to open up real quick for you. Okay, so then you're just looking for the anatomy. The anatomy is under the bridge. Just think under the bridge here, okay? Under the bridge of the road. So you don't want the vertical part. You want under the zygoma. So what we're going to do on this one, we don't have the bone plate in place or anything. We just make a hole. Now what we're looking for is an angle about like so, okay? Not straight in, not straight up, an angle, it's about 45 degrees, let's say. And so we're over on the side under the bridge of the zygoma at about a 45-degree angle or so, lateral to the intersection between the vertical and the horizontal. Boom, done. Okay, now you may get double cortical plate here, so with the 0.8 millimeter pilot hole drill, you want to take the drill all the way to the bottom on that one because you may get the floor of the sinus, and we want that if we can get it. And let's see, I can't see my pilot hole. Where is it? There. There. Okay, so I'll just start to screw it in here. Okay, let's direct it where we want it. Okay. Here, I'll poke my finger in the patient's eye. They wouldn't appreciate that, would they? They aren't staying very still, so I guess I have to do something. Okay, I'm trying to do it so you can see. Okay, almost all the way down so that you can still move it, okay? And then you check your twist. You say, well, I still have a little bit more rope to go. So adjust the length of the rope. And be thinking if you went clockwise or counterclockwise before. All right, and then just thread one of the wires. Let's see, we're getting a little bit crowded here where we're going to place this, but I guess we could make it work. Under the arch wire. And the other one also under the arch wire. Open for me, please. Yeah, thank you. Okay. And then we'll give it a couple of twists. And I'm going to ligate it to where? To the bracket base. To the bracket base. Nice and tight now. Nice and tight. Okay, and then probably what happened to my screwdriver? Here it is. And then I'll probably make it just a little, seat it all the way down here, make sure that it's all the way there. And then, yes, it should be that tight, okay? Zygoma ligation, that's it. I just have to cut and tuck. I can find my pinnature cutter. Here it is. Cut and tuck. Leave it long like the others with this 012 ligature tie. And just twist it out of the way. Make sure it isn't sticking out and hitting somebody. Okay, zygoma ligation. There it is, zygoma ligation. We use it for growth restraint, class 2 cases, okay? Growth restraint, here it is. Nice tight rope. Okay?